Good evening and welcome to the Federal. Today we are here to discuss a pressing issue, pertaining to the foreign medical graduates in Tamil Nadu. The foreign medical graduates are facing issues because of the delay in securing their provisional certificates, and which delays the further process of internships and registration with the Tamil Nadu State Medical Council. So today we have with us Dr. Sri Ragav, who is the executive committee member of the Tamil Nadu Medical Students Association, the Foreign Medical Graduates Wing, to discuss more on this. Thank you so much, Sri Ragav, for joining us today. Uh, Starting when we talk about this issue, there are several issues being raised, which begins with the delay in the provisional eligibility certificates, and which delays their permanent registration. So, why is there so much of a delay? And this is something that has been a problem almost every year. Raghav, what is it that is causing a roadblock?
Okay, first of all, good evening, everyone. I am Dr. Sri Ragav, and I just completed my FMG in my December 2024, and I just applied for my internship. And as you asked the question, we were facing this issue every year, almost every year, and I just heard about it every time. I just know about from my friends, and so now I'm facing it directly, and I just came to know the ground realities, what's going on, and yeah. So the problem is, first of all, the problem starts with the TNMC, okay, which is the Tamil Nadu Medical Council.
Yeah.
So, as you know, every other states have their own medical council, as well as Tamil Nadu has its own medical council. Every other states, it's not happening this much delay, except in Tamil Nadu and Kerala.
Okay.
The thing, the reason what I think maybe is due to lack of employees, maybe, or they are like very negligent about the FMG. So this is what going on, I guess.
Yeah, like you said, the negligence when it comes to FMG, like FMGs have continuously pointed out that just because we are foreign medical graduates, is some sort of a discriminatory attitude towards them. Do you think that could be one of the reasons? Is there some such issue that has been raised by FMGs when it comes to TNMC towards them?
Yeah, actually, that's one of the main reason where actually this all starts not from TNMC. Okay, this starts from the medical colleges and from their seniors. Okay, the IMGs, so-called IMGs, Indian medical graduates. So not everyone. I'm not pointing out everyone, but this is happening. What everyone is assuming is FMGs are the students who just went for some vacation for 6 years, and they are just roaming here and there in the country where they are studying, and they are probably like going for some partying or somewhere, but except studying, what all the extracurricular activities they think we are doing, okay, which is not
But there is
happening
the
at all.
FMG
Yeah,
exam
of
for that,
course.
right? Like, yeah. So it's not like the
Yeah,
certifications
that's
are
the thing
asked.
I'm saying.
Mm,
Their
right.
assumptions were like this: we are just enjoying somewhere, not only. So this starts from the Indian medical colleges and it travels till the Ministry of Health. Okay, so everyone in this system thinks FMGs are just enjoying their life, 6 years of their life, and they are just studying for 6 months to 1 year to clear their FMG exam, and they are just doing some few years of just some months of internship, and they're just entering to the system, which is absolutely wrong, because without studying or without passing the exam we cannot get the degree from our university.
Correct, correct. True. Yeah.
So everyone in the system should get some informations from their relatives or someone who might be a FMG, so that they know.
Right. So, like, when we talk about the delay in the provisional certificate, How significant is that when it comes to securing the compulsory rotatory residential internship, in Tamil Nadu? And how does it impact the practice? I mean, that's like a further delay, right?
Of July happened in
Yeah.
Chennai, and the
Mm,
main reason is due to the delay. Okay,
mm,
actually, as I said, we are studying 6 years in the country where
mm,
we are studying from the country.
mm,
Most of the FMGs studied 6 years, not five
mm.
years. As in India, if you finish 5.5 years, you will get the permanent registration. Okay, but in
Correct.
other countries,
Mm,
we have to wait 6 months just to enter the university, and after that
okay.
we have to study for 6 complete years. So 6.5 years already gone. Plus
Mm,
we have to prepare for this FMG. If someone is
mm.
cracking the FMG at their very first attempt, at least they need 6 months. At least they need six
Correct.
months of hard work, which is
Mm,
the
mm.
FMG is not something easy nowadays. Nowadays it's equivalent to NEET PG. So
Yes.
they are giving their own efforts to finish this,
Mm,
and it's been like around 7 years. Okay,
mm,
and after that they have to apply for this internship or permanent
mm,
registration, whatever it may be.
mm.
In some state, as I heard, like in Karnataka, they are far efficient. They are very far efficient. They are
Mm.
just doing in 1 month. Within 1 month, they are finishing everything, the whole process, and they are asking their students to join the hospital and to do the internship. Why it cannot?
Internship.
Why it can't be done in Tamil Nadu? Yeah, why it can't be done in Tamil Nadu? The Karnataka and Tamil Nadu were in the same country, not somewhere in some
Mm.
other countries.
Yeah. Mm,
Okay,
mm,
so the same rules applies here and there also. Then why can't be this much efficient?
mm,
Okay,
mm,
after
mm.
that we have to complete one more year of internship, which will be around 8 years. And so, if a FMG student properly, if he studies, he have to wait for 8 years to obtain his
Correct.
permanent registration in
Mm.
India.
Right.
But in Tamil Nadu, it takes 9 years. Okay, the 1 year the after applying for the PC, they are
Mm.
making us to wait for 1 year, one whole year for the
And
last
that's
4 years.
a long
Till
time. Yes. Mm.
till 2020, it was like same like Karnataka. In 1 or 1.5 months, every students got their CRMI and they just started, and they have got their
Mm.
PR, permanent registration, in 8 years. So after that, they have to pursue their PG. Nowadays, just a MBBS
It's
is
not.
not considered as a value. Yes.
Mm.
So like every hospitals literally without PG degree you cannot lead your life
Mm.
nowadays. It's very difficult for a
Correct.
MBBS student.
It could be a specialized doctor in a specific specialty.
Yeah, for that we have to again we have to start studying for another 1 year for NEET PG or something. After
Mm,
that,
mm,
three
mm.
years of PG studies, and it will be around 15 years, to be a doctor, to be a specialist doctor in India for FMG.
Mm, mm, mm,
So
mm.
these delays. So what we are expecting is to cut down these delays in issuing this
Right.
PEC or giving this
Mm,
internship period. And
mm,
what are the excess periods? Like, if a state in India can do all this in a very short time, why can't
mm.
it can be done in another states? If a
Right.
state can able to follow the NMC's regulation, why another
Mm.
state cannot do the same? Why there
Not
is
the
much
same.
difference in
Mm.
the systems?
Right, right.
So
You mentioned other states, right? Like where it has been followed. Like you give the example of Karnataka. At the same time, we have observed that there are issues pertaining to delay in provisional certificates in Andhra Pradesh as well, and also in parts of Kashmir. What do you think is the reason behind this being reported in several other parts as well?
okay, first of all, the thing is, the main reason for the delay in giving the internship is due to lack of vacancy. So
Mhm.
what
Okay.
the protest led on 5th of July is
Mm.
led by Dr. Ravindranath, the General Secretary of DAC, Doctors Association for Social Equality, Dr. A.R. Shanti Madam, and Dr. N.M. Saran, President of TNMSA, Tamil Nadu Medical Association of Student Medical Association, FMG Wing, and Dr. Vasant Philip Abhishek, the General Secretary of TNMSA, FMG Wing. So these people just, along with them, other members of the TNMSA, just plan for a protest about the ongoing
Delay.
problems facing by the, yeah, delays and the delay. Okay, it's like a chain reaction actually. Okay, so
Okay.
the central government has given a percentile of 7.5.
Okay.
The central government has issued a percentage of 7.5 for the FMGs
Okay.
to practice in the NMC approved medical colleges. Okay.
Okay.
So
Hmm.
what we are asking is just to
Hmm.
increase the 7.5% to
Hmm.
20%.
Hmm.
Dr.
Hmm.
MK,
Hmm.
Tamil Nadu Chief Minister, Mr. MK Stalin has written a letter to central government regarding this issue few years back,
Okay.
and
Hmm.
we are just asking it to imply not only for Tamil Nadu, for all the nation, for all over the nation. The reason is,
Right.
before like 5 6 years, this there was not much FMG students compared to
Hmm.
now. Now
Right.
the amount of now the percentage of FMG students in our nation is much higher than before.
Hmm.
Every year, around 1,400 students were qualifying this FMG exam,
Hmm.
and they are waiting for their internship. It's kind of accumulating due to
Right.
lack of seats. It's kind of
Hmm.
accumulating,
Hmm. Hmm.
and
Hmm. Hmm.
the only way to reduce this accumulation and this delay is to increase the seat
Number of seats.
percentage from 7.5 to 20%. Yes, number of seats. And also to add all the district hospitals. Now, yesterday, NMC has released some notification regarding the practice of students and professors and everyone in the district hospitals which has a capacity of more than 220 plus beds. So we
Hmm.
have to regulate that notification, and we have to start as soon as possible to possibly
Hmm.
reduce these delays, because this delay is not only it's like a chain reaction. As I said, it's like a chain reaction. So it
Hmm.
delays all our further studies, our
Right.
PG studies. Also,
The
in our country, we
practice.
are in great need of doctors. Okay, yeah, practice. We are like in lack of doctors. Still, we are in lack of doctors all over the
Hmm.
India. Of course, it increased compared to before, but we need more doctors. The only
Correct.
way we can get is to at least to make these people who are waiting for this internship, just to
Hmm.
make them to finish their internship and to give them a registration.
Correct. Right.
Also,
Right.
this mentally breaks everyone.
That is that. I mean, definitely, this is a mental strain for all the FMGs who are waiting for the certification. So, besides, like you mentioned, the lack of seats is a very big problem. And before we close on this, I want to understand like what other measures has the FMG Association proposed to the National Medical Council or the Tamil Nadu Medical Council to streamline this whole registration process, because this seems to be a lot, like a issue every year, and the internship allocation process also needs to be streamlined, so all of this is being done there. This issue would not be a perennial thing almost every year. So what can be done besides the increase of the seats?
Okay. So, as I said, the DASC, Doctors Association
Hmm.
for Social Equality, had done several measures over the past
Hmm.
few years. Like for
Hmm.
4 5 years, they were like working on these issues, and they have
Hmm.
done like then they have like done many changes in
Protests
this
regarding.
system.
Yeah.
Like
Hmm.
before before we have given like before the students have were paying around 3.5 lakhs for their
Hmm.
internship fee, and
Registration.
they have like made some protest, and they just reduced it to 30,000 rupees or something nowadays. and etc. So now even the protest, what they are saying, what everyone is like, what the agenda of the protest is like, the TNMC, Tamil Nadu Medical Council, the people who working inside, not everyone is very competitive. Not everyone. I'm not saying not everyone is working very bad or something. Yes, they are doing their best, but there should be some regulations. There should be some regulatory mechanisms. They should
Right.
monitor what's going on, and they should know. They should get the information what's going on
Right.
apart from the just the registration or something. We should need the FMG welfare centers all over the districts, all of the
Correct.
India. We need the FMG welfare centers, because
Centers.
for all these things, all the small doubts or anything, we cannot go and ask the medical council itself, because
Right.
as I said, like apart from answering these small doubts or something, they have many works to do. Yeah, I agree, but but the regulatory mechanism should be very good, and the people who are working inside, whoever like they are checking us, should be a doctors. Not I mean
Right.
not all the postings, but if someone is like manually verification, someone is doing some manual verification or
Verifying.
something, for asking some for knowing our concern and everything, there should be some doctors, some higher official doctors, so that they know our pain, what we are going through. So
Right.
these are
Right.
the changes we want, and I just kindly request our honorable health minister, honorable chief minister, to look into this problem and just give us a solution as soon as possible.
Okay. Thank you, Dr. Sri Raghav, for joining us today. Thanks for your inputs.
Yeah, thank you.